Well, balance is ultimate goal, right? And my focus is on quality over quantity in my professional and personal life. And so with it, I have to have some time for my own wellness, because if I preach wellness, then I cannot run on low. That's pretty much it. Yeah.
And do you do that through exercise, recreation, meditation? What's your own personal?
All of the above, I would say. Some exercise, some meditation, some music. Yeah.
Just making some time for yourself.
Yes, for sure.
Yeah. Okay, great. What advice would you give to somebody who is either transitioning into this field or just coming out of school and getting started in this field?
Well, I would say that invest in education and never stop learning. And know your patient and know anatomy. And of course, genuine care is always important, because it has to be genuine in order to be successful and feel good about what you do, I guess.
Yeah. Sure. And in terms of education, that plays into the conference here. Conferences like MedSpa Pro, provide all these different tracks and opportunities and networking and stuff.
Right.
Talk a little bit about why you think it's important for people to go
attend.
To a conference like
Right. Not even like this, but specifically this MAP conference is, to me, showed that there's a focus a little bit different, not on what, but mainly on why, right? There's advanced technologies, endless amount, but we need to know, constantly keep in mind our aesthetic medicine philosophy in order to use specifically some technology for specific patient. And that's here very much emphasized, and I like it.
Mm-hmm. And so did you speak here?
Not yet, tomorrow.
Okay, so tell us a little bit about what you're going to talk about tomorrow, and give us a few of the takeaways that you're hoping to leave people with.
So I'm going to talk about two things. First is holistic aesthetic medicine, and also rejuvenative techniques in aesthetic medicine, cell rejuvenation. And holistic aesthetic medicine, it's basically what I just said, right? We live longer and longer, doesn't mean we'll live better, right? And so in order to put some value and quality in those extra years, we need to take care of ourselves. And before it's too late, because there's some point where you really cannot do much, right? And you have to go into very invasive things if you want to feel or look better. So that's the bottom line of this. And I'm going into the hormones and how each hormone would influence the skin. Actually, I'm presenting 12 cases, my own patient cases, and each of them have, different problem. Some of them has some patient melasma and rosacea and metabolic syndrome and Cushing syndrome and a lot of different things. And how those people come to me, some of them already know, but some don't even realize they have some problem. And by uncovering, looking at their skin and listening to their story and doing some labs, we're actually getting results much faster, and not only faster, but sustainable, and results which I wouldn't get just with treatment, outside treatment. So like rosacea, for example, which I didn't know that I can treat. Well, it's not in the literature, but if you treat the gut, GI system, then rosacea gone. So that's the bottom line.
So you're practicing root cause medicine?
Absolutely. Yep.
Yeah, I got to imagine that's rewarding, because when you
very much.
Just instead of putting a Band-Aid on a symptom kind of a thing, you're helping somebody change their life.
Absolutely. It's not just a skin outside, and that's, yes, I have very lucky because of that. Yes.
Thanks.